So we are studying about respiratory system that we completed lungs and pleural membrane, trachea, bronchial, and alveoli. Now we talk about mechanism of breathing, how we breathe, and how much amount of air we inhale and how much amount of air we exhale. It is very, very important. Okay. Ventilation is the term for the movement of air to and from the alveoli. The two aspects of ventilation are inhalation and exhalation. Ventilation is what is ventilation? Ventilation is movement of air in and out in the alveoli. In the alveoli. So another we have ventilator machine also. Ventilator is a machine forcefully with forcefully it will give oxygen. It will inhale oxygen. It will exhale carbon dioxide. Okay. In the ICU, if lungs are failed or any mechanism is failed to breathe, we will give temporary ventilation. Okay. So inhalation and exhalation within the alveoli. So this is known as ventilation, which are brought about by the nervous system and respiratory muscles. So who would help? Nervous system will help and respiratory muscles are there, like our intercostal muscles, okay, diaphragm. These will help. The respiratory centers are located in the medulla and pons. So where does respiratory centers are there? Medulla and pons. Medulla and pons. We'll see. So we have medulla and pons. Their specific function will be covered in their specific function will be covered in later section. In the medulla, that generate impulse to the respiratory. So basically, if it is medulla, in medulla, we have a respiratory center. So if example, it is respiratory center, nerves are connected to the respiratory muscles. Respiratory muscles. These muscles are diaphragm and external and internal posting muscles. So diaphragm and internal and external. Internal means the muscles which are attached to the ribs. If it is ribs, it is internal. It is internal is external. Okay. So if it is attached here, it is external muscles. If it is attached here, this is internal muscles. So we will call specific term is given intercostal muscles. Inter means inside, coastal means ribs, muscles means muscles. Okay. The diaphragm is dome-shaped muscle below the lung. So this is the diaphragm already we studied. We know about that. Okay, fine. When it contracts, the diaphragm flattens and moves downward. So whenever lungs contract, so it moves downwards. When it is relaxed, it will go upward. Okay. The intercostal muscles are found between the ribs. The external intercostal muscles pull the ribs upward and upward, upward and outward. So what external? This is the external. This is internal. External will pull outside. Because they are outside. Whenever we inhale, Inhale means in the lungs there is air. So that's the reason lungs are expanding. So we need to pull the muscles outside. So external intercostal muscles will help along with diaphragm. Okay, next is internal coastal movement. We relax. What we need? We need the lungs to be relaxed because oxygen is sending to the outside environment. Oxygen is exhaling. Okay, oxygen is coming outside. Basically, which muscles will help? Internal intercostal muscle. External intercostal muscles will output. It will inward. It will relax. Ventilation is the result of respiratory muscles producing changes in the pressure within the alveoli and bronchial. So basically, not only lungs, we need muscles to help the lungs to inhale and exhale. Okay, this is very important. Okay. So medulla is connected to the diaphragm. Medulla is connected to the intercostal muscle. Medulla is connected to the external intercostal muscles. So these are three muscles helpful. Means three combination of muscles is helping for respiration and expiration, inhalation, exhalation. Okay, so this is very important. So what will happen if the diaphragm is damaged? If intercostal muscles are damaged or external intercostal muscles are damaged, so what will happen? So the patient will feel difficulty in breathing when if external muscles damaged while inhalation. Intercostal external internal intercostal muscles damage. So what will happen? Exhalation is difficult. Diaphragm is damaged. What will happen? Inhalation, exhalation. Both are. So this is very important. We need to understand. With respect of breathing, three types of pressures are important. So basically, these are the our body pressures which are able to help us. But there is external and internal pressure also we need to know. That is three types of pressures are there. Atmospheric pressure. Pressure means the amount of energy or the amount of specific amount the air enter. Air enter a specific amount of energy is required. So that is intimate pressure. So we have atmospheric pressure, intra-pleural pressure, intra-pulmonary pressure. So basically, three types of pressures are there in the environment, okay, in the lungs, outside the lungs, inside the lung, outside the lungs, and outside our body. Okay. The pressure of the air around us at sea level, atmospheric pressure is 760 mm of Fahrenheit. At higher altitude, of course, atmospheric pressure is lower. So we are living above the sea level. Okay. So the basic amount of atmospheric pressure is 760 mm of H. Means the if the air enters, the pressure is that much. Intrapleural pressure, the pressure within the facial pleural space between the parietal pleura and visceral pleura. This is potential rather than a real space. A thin layer of serous fluid called the two pleural membranes to adhere to one another. Intrapleural is slightly below atmospheric pressure and is called negative pressure. The elastic lungs are always tending to collapse and pull the visceral pleura away from the parietal pleura. The serous fluid, however, prevents actual separation of the pleural membrane. So basically, in the intrapleural means outside the lungs. Pleura is there. Pleura is the covering of the lungs. We have vessel and in that we have visceral fluid also. Okay, intrapleural pressure is slightly lower than atmospheric pressure. Atmospheric pressure means is 700, it will become 600. If it is 500, it will become 400. This is how to get. Intrapulmonary pressure, the pressure within the bronchial tree and the villi. This pressure fluctuates below and above atmospheric pressure during each cycle of breathing. So basically, here in the within the lungs, the pressure will be decreased, the pressure may be increased. The pressure may be increased, the pressure may be decreased. It will depend upon our breathing. So basically, we have to remember atmospheric pressure mainly because atmospheric pressure will change. If it is below the sea level, it is difference. It is above the sea level, it will difference, and it is above the Himalayas. There are atmospheric pressure very. So we need more pressure to breathe. Like now, easily you are breathing because the air is forcefully is presenting in the atmosphere, so it's easy to like it is very important how to. Next is inhalation. How inhalation occurs in how much amount of oxygen we are inhaling. This we will go here. So inhalation. Inhalation is also called inspiration. Inspiration. Inhalation. We are inhaling with our nostrils. It is a precise sequence of events that may be described as follows. Motor impulse from the medulla travel along the phrenic nerves to the diaphragm, along the intercostal nerves to the external intercostal nerves. The diaphragm contracts, moves down and expands the chest cavity from top to bottom. The external intercostal muscles pull the ribs out and out, which expand the chest cavity from side to side and front to back. So here, very important things we have to remember. Okay, that is three things. One is inhalation. How happen? We have the area called medulla. Okay, in the brain, you see the medulla. From that, we have the one nerve which is connected to the lungs. The lungs. That is phrenic nerve. So actually, phrenic nerve is connected to the diaphragm, not lungs. It's diaphragm. Okay, it's connected to the diaphragm. And we have another muscle that is intercostal muscles, the nerve supply to the muscles, external, internal, intercostal muscles. Okay. So, so here medulla will give impulse. So impulse travels to the diaphragm from the intercostal nerves. The impulse travel to the intercostal muscles, maybe external or internal. So likewise, breathing happens because the diaphragm pulls, the intercostal muscles pulls. So lungs expand. As the chest cavity is expanded here, the parietal fluid expand with it. Interpleural pressure becomes even more negative as a short of suction is created between the pleural membrane. The adhesion created by the serous fluid, however, permits the vessel fluid that we expand to, and this expand the lungs angle. As the lungs expand, intrapulmonary pressure falls below atmospheric pressure and air enters the nose and travels through the respiratory changes to the environment. Entry of air continues until intrapulmonary pressure is equal to the atmospheric pressure. This is normal entry. Of course, inhalation can be continued beyond normal, that is deep breath. This requires more forceful contraction of the respiratory muscles to further expand the lungs, permitting the entry of more air. So basically, so how the inhalation occurs? So this is the first step. Second step is when our lungs are expanding. Muscles are supporting to expand the muscles and expanding the lungs. It will be intercostal muscles, it may be diaphragmatic muscles. So basically, what will happen when the lungs expand, the pressure outside environment, inside environment is more. Outside environment is more than inside environment. So what will we have pleural cavity. So lungs will expand and the pleura will reduce the pressure. So when the pressure will decrease. So when external atmospheric pressure is equal to the lungs intrapulmonary pressure, so then the expanding is stopped. Then we exhale the pleura. But in deep breath, the lungs expand more than we expect. So this is the inhale. Now we will talk about exhalation. The same process, but opposite to the inhalation. So here we have the motor pulse from the medulla. So then same area, medulla oblongata from the brain will decreases the diaphragm and intercostal muscles to relax. Second thing. And the chest cavity becomes smaller, lungs are compressed, elastic connectivity to which is stressed during inhalation, recoils, and also pressure the press the alveoli. As intrapulmonary pressure rises above atmospheric pressure, air is forced out of lungs until the two pressures are beginning. So we need pressure, more pressure than atmospheric pressure to exhale the air. Very important thing. Then only the air will go outside the environment. Because in the environment, always there is air. Why? By atmosphere, you need air. So we are forcefully withdrawing our air, our oxygen, carbon dioxide in the atmosphere. Okay. So that is the reason we need more pressure than atmospheric pressure. Notice that inhalation is an active process that requires muscle contraction, but normal exhalation is passive process. Depending on the great extent on the normal elasticity of health lungs. In other words, under normal circumstances, we must expand energy to inhale, but not to exhale. So basically, active process and passive process. Inhalation active, exhalation passive. Means inhalation needs energy, exhalation doesn't need energy. Okay. We can, however, go beyond a normal exhalation and expel more air, such as when talking, singing, balloon blowing. Forced inhalation is a exhalation active process that requires contraction of other muscles. Contraction of intercostal muscles push the ribs down and squeeze even more air out of the lungs. Contraction of abdominal muscles such as rectus abdominis compress the abdominal organs and pushes the diaphragm upward, which force more air onto the lungs. Basically, uh, whenever we are doing any work, like any thing like talking, like I'm delivering the class, so I am giving more, I need more air. So it is beyond the normal exhalation. Singing, blowing, balloon need more passive energy, active energy. Okay, or to exhale more air, we need more energy because we are expanding, expelling our air from the body more than our requirement. More than our requirement, we are exhalation. We need other muscles to support this. Like we are exhaling with the sound. So the abdominal muscles will also along with diaphragm, along with intercostal. Okay, so this is very, very important. We have, okay, I think understood about inhalation and exhalation.
Yes, sir.
So now we will talk about pulmonary volume range. So you can see here that is the exhalation, air is moving through, and these are relaxing happening diaphragm. These are the intercostal muscles. Here you can see these are the lungs. This is coming close and it is expanded. Diaphragm is also expanded, intercostal muscles are expanded, these are the intercostal muscles. This is the lungs. So you can understand that with this diagram, you can able to understand. Next is pulmonary volume. The capacity of lungs. Pulmonary volume means how much amount of air enter into the lungs and how much amount of air exhale from the lungs. So it is depend upon the size, it is depend upon the age of the person. How much taller are people, they have taller lungs, but shorter people have shorter lungs. Okay, but in older people, the lung capacity decreases because in the older person, the lungs capacity decreases due to their elasticity. Okay, because of the muscles efficient, diaphragm, coastal muscles, lungs, tissue, all will decrease. So there is a reason in older people, pulmonary volume also decreases. So here we have the lung volume. Basically, one is the name as tidal volume. You have to remember all these names, very, very important. What is tidal volume? The amount of air involved in one normal inhalation and exhalation. The average tidal volume is 500 ml. But many people often have lower tidal volume because of shallow breathing. Basically, the amount of inhalation of air, the amount of exhalation of air is totally will called as tidal volume. So we have need 500 ml. Okay, 500 ml of volume in each. The amount of okay. Next is minute respiration. The amount of air inhaled and exhaled in 1 minute. Minute respiration volume is calculated by multiplying tidal volume by the number of respiration per minute. Average 10 to 20 minutes. If tidal volume is 500 ml and the respiratory rate is 12 minutes per minute. Member is 6,000 ml for 6 liters, 8 per minute. So here in one average breath, tidal volume is for one breath, but respiratory volume, minute respiratory volume in 1 minute, how much amount of air inhaled, air exhaled. So we need to multiply 500 into, you know, check on the diaphragm, above the diaphragm, intercostal area, or the sternum. We have to put our hands, we have to count the breathing. 1, 2, 3, 4, 5, like that. Okay. Then multiply with 500. So example, it is between 12 to 20, but we calculated 12 only. Multiply 500 into 12. How much ml? How much? 600 ml means 6 liters. Next is inspiratory reserve. The amount of air beyond tidal volume that can be taken with the deepest possible area. Normal inspiration reserve is from 2000 to 3000. So basically, sometimes what we will do deep inhalation, deep exhalation. At the time, some amount of air will uh, kept in that area. It is not counted. So university is 2000 to 3000. Likewise, expiration also. So what is vital capacity? More important is tidal volume. Vital capacity, the sum of tidal volume, inspiratory reserve, and expiratory reserve. Stated another way, vital capacity is the more amount of air involved in the deepest and for the most amount. It is not that much important vital capacity. Residual air, all this are same. But one important thing is tidal volume and minute respiratory volume. So basically, whenever we are keeping ventilator support. For those people who are not able to breathe, like in COVID-19, the tidal volume are decreased. The tidal volume are decreased. So that's the reason they are putting ventilation support. So during my duty as a number of patients in COVID-19, so advised for ventilator support. Some people came back, some people died with that. Some of volume just described can be determined the distance of spirometers, which measures movement of air. Trained singers and musicians who play wind instruments often have wider capacity much larger than the expected from their height and age because the respiratory muscles have become more efficient with practice. The same is true for athletics who exercise regularly. A person is emphasizing, however, you must work to exhale and vital capacity respiratory volume are much often lower than average. Basically, so with the help of spirometers, we will able to check the volumes, and two persons more volume than their capacity, that is like singers, we are giving the different speeches, teachers, and athletics, swimmers, likewise. Because they work regularly, their muscles expand more than us. Next, another type of pulmonary volume is alveolar. Alveolar ventilation. So because in the alveoli, how much amount of oxygen is coming, how much amount of oxygen is going, which is also we have to go on, which is amount of air that actually reaches the alveoli and participate in gas exchange. And average standard volume is 500, of which 350 to 400 ml is the alveoli delta inflection. So only 350 to 400 amount of oxygen is we are inhaling ml, and we are exhaling carbon dioxide. So remaining amount is known as anatomic dead space. What we will call? We will call dead space. The air still within the respiratory passage, despite the rather grim name. Anatomic dead space is normal. Everyone has. So we need to have everyone have anatomic dead space. About that. Physiological dead space, which is not normal, and is the volume of non-functional alveoli that decreases gas exchange causes of increased physiological dead space, including bronchitis, pneumonia, tuberculosis, emphysema, asthma, pulmonary edema, lung collapse. Physiological dead space means the alveoli is not working. There is the air is also not entering, the air is not also coming outside. So it is more dangerous, like number of diseases here given bronchitis, inflammation of bronchi, bronchioles, pneumonia, TB, emphysema, asthma, edema, collapse. The compliance of the thoracic wall and the lungs, there is that normal expansibility if necessary for surface alveoli ventilation. Thoracic compliance may be decreased by factor of scoliosis, neurosis, or ascites. Lung complaints will be decreased by any condition that increase physiological response. Normal complaints that promote sufficient capacity in alveoli. In some cases, we have damage of thoracic wall or lungs, like accidents, like any uh, stabbing, anything will happen. Also, okay, so that's in that reason, what will happen? We have physiological dead space. In that cases also, the lungs is not able to fulfill, air is not in going into the alveoli. So in detail, we talked about inhalation, exhalation, and pulmonary volumes. Tomorrow we'll discuss exchange of gases. How the exchange of gases, oxygen and carbon dioxide, caustics, and how the carbon dioxide is, how oxygen is reaching and carbon dioxide is eliminating from the blood. Yes. How the we are regulating continuously respirating. This is the third topic. Next is this is the oxygen and carbon dioxide. Basically, we have chemicals, we also chemicals. So in our body, we have to maintain acid-base balance. The three important topics that remains, we will continue. If any doubts, please ask.
Sir, in the plural memory you said about the
Plural?
uh, which is very decreased compared to the atmospheric pressure.
Pleural membrane, atmospheric pressure. You are asking about that.
Because said the pleural membrane pressure will be less than the atmospheric pressure.
Basically, I can give example. If there is a wall, we are hitting on the wall. So basically, wall is more powerful and more stronger than wall. So that's the reason wall is not passing that wall. Okay, so that's the reason the wall is not going outside. So basically, likewise, this is the lungs. Okay, this is the lungs. Okay, so this is the covering. This is the pleura, visceral pleura, parietal pleura. In that space, this is the pleural fluid. Okay, so the lungs are expanding. So the pressure, the pleura is able to stopping that pressure. So here from that we are giving negative pressure, we are getting positive pressure. Okay, so likewise, if the pressure inside the lungs and outside the lungs are same, what will happen? The expanding of lungs are stopped. Then air enters, then exhalation of air will happen. Understand? So pleura is having capacities to stop the inhalation because if he expands continuously lungs, what will happen? It will collapse. The atmospheric pressure will give will it will collapse the lungs. So there's the reason we need any stoppable thing that is what thing as pleura. Okay, understood?
Yes, sir. Yes, sir. Then liquid is also there inside the pleural membrane. We have studied that
Sorry.
pleural membrane liquid. This